On this slide, I'm demonstrating the double hit model of acute brain injury and how it relates to ARDS. On the left side of the screen, we have the catecholamine storm and the inflammation, systemic inflammation from the acute brain injury. And the systemic inflammation is caused by the neurotransmitters releasing the catecholamines. These catecholamines, this is the first hit, and these catecholamines travel to the normal lung. And then we get the second hit from the increase of catecholamines, but also from the high tidal volumes that are used, and also the inadequate PEEP to the primed lung, and then leading to ARDS. Now this ARDS also increases the catecholamine in the system, leading to a secondary brain injury. So you can see from this model that ARDS and traumatic brain injury are closely related and can be quite a quandary for clinicians. Again, this is another model that relates adult ARDS to acute brain injury. At the top of the screen, you see the acute brain injury model causing the systemic inflammatory bioresponse. We see an increase of biotrauma, increase of systemic inflammatory disease, neurotoxin inflammation, and then possible down the road organ dysfunction. And these, of course, are associated with poor outcomes in our patient populations. Cerebral blood flow. It's really important to keep in mind that what is needed for these patients is a good cerebral blood flow. Normal cerebral blood flow is about 50 to 60 milliliters per gram per minute. Now there is something called the Monroe-Kelly doctrine that says that the volume in the cerebrum, the cranium, is equal to the brain plus the blood plus the cerebral spinal fluid.